Hey, Butch Zemar here. Just a couple things here as every employer should know about healthcare reform. Uh, Things that you need to know. One is, do you meet the benchmark for the number of employees? Some of the employers are going to get creative and try to move some of their full-time employees to part-time, but they have a full-time equivalent scale, and they're going to add up all the part-time hours to see how many would that have been for full-time. And if you meet that 50 mark, you qualify for new regulations in the 50 and above. If you're on 49 or less, you won't have to comply as much. But if you're 250 and more, there's some other compliance you have to worry about, such as health insurance costs reporting on W-2s if you have more than 250 W-2 statuses that you need to file. Another thing is some of the small businesses may qualify for tax credit. They have to buy the health insurance through the exchange, or what they call the SHOP program, the Small Business Options Program. It's delayed right now, but let's assume it's in place in time. That's the only way you qualify for the tax credit for the small business level. There will be a number of taxes and fees that are going to be implemented in the premium. And this is important for business owners to try to expect some increases over a period of time to add these things in there. So that way it's not a sticker shock. But be aware when it's going to start and what the taxes are for. Um, you have to notify all your employees that there is an exchange available or marketplace. Insurance carriers will help you distribute that information, but you're required to let them know. And then on top of that, by knowing that they could qualify for some subsidies if they buy inside the exchange, if they if there's the guidelines meet that the plan is not affordable for that employee, accordance with the Affordable Care Act. Now there's some out-of-pocket maximums that are going to be applied. This really came into play because some businesses were applying huge amount of out-of-pocket expenses for employees, and now there's some limits involved and that could work out to some employee favors. There's some essential benefits that are going to be added to the plan, such as maternity and preventative care. A lot of that's already been implemented. It may not be much of a change for you, but in some of the policies in the marketplace, you're going to see a drastic increase in these core benefits. So all in all, a lot of these things are going to be added to healthcare plans, which in turn will hit the end user, us paying the premiums. So the premiums are naturally going to go up to help cover some of these benefits. These are just a few things that you need to know. Keep updated, and as things unfold, we'll find out what other things are going to be involved, and hopefully we'll know in advance, or you will, as the business owner, know in advance, far enough in advance so you could plan and prepare for your 2014 business.